Welcome to Nurse with Nora, brought to you by Rora. I'm your host, Nora Latore. I'm thankful to have you listening along. Please remember to like and subscribe to Nurse with Nora wherever you listen to podcasts. It really does help. Welcome to the Nurse with Nora podcast. I'm Nora Latore. I am so happy. Today I have with me an incredible visionary, Dr. Manasa Mantravadi, who is a CEO. She is a pediatrician. She is a mom of three, an unstoppable go-getter, an incredible wing woman, a philanthropist, and so much more. Welcome.
Thank you. Everyone, I definitely baked her cookies to say that. All those nice things about me.
You did promise me a home-cooked meal when I come to Indiana, which I'm going to take you up on because you are an incredible chef as well. So
Home-cooked Indian meal.
Yes, my favorite. And well, let's start there. Let's talk about culinary medicine because that's something that through all of your different hats that you wear, being a mom, being a CEO, being a doctor, you really put culinary medicine at the center. What is culinary medicine and why is it so important to you, or why do you think it's a huge opportunity for the future?
Yeah, so it's interesting. I trained as a pediatrician. So everything I did was very traditional pathway. You do med school, you do residency, you do fellowship, and I actually did fellowship in endocrinology, pediatric endocrinology. And throughout the course of my career, I saw a lot of changes that happened very quickly to children. So when we started med school, type 2 diabetes was an adult onset diabetes and type 1 was childhood, right? By the time I got to endocrinology fellowship, we had full clinics called metabolic clinic, obesity clinic, and diabetes clinic that was type 2. And so there was this huge shift in the conditions of our children. And what I quickly realized is as a doctor training in America, a lot of our training is focused around treatment. And so that was kind of one wake up call in really understanding the preventable diseases in this country truly are related to food and our food system. And at the same time of my kind of pediatrician doctor journey, I also became a mom. And so during that same journey and in parallel, I became obsessed as soon as I had twins first. I had these two little humans that I was responsible for.
I should
And
start with that. Twin mom, CEO, entrepreneur, pediatrician, twin mom.
twin mom, and also crazy enough to have another one after the twins. So crazy person. So that to me was like another kind of light bulb moment because, I grew up eating really healthy food, fresh cooked meals. My mom, Indian food cooked every night, right then and there, minimal food waste, and it was all fresh. So I didn't know any better. So when I had kids, I was like, well, obviously this is what you do because I don't know any better. Also, I'm scared of my 5-foot tall Indian immigrant mother. If I dare serve anything other than home cooked meals. But what I, combined with my pediatrician knowledge on nutrition and development and growth and what that really meant, and then looking at outcomes in endocrinology on what was happening to children, I became very, very focused on making sure that food was a priority for my kids. So everything from making their own baby food to really now teaching them healthy eating habits and kind of getting them involved in food. So it was these parallel journeys that I was going through from, 20s, 30s, and now 40s. And then, so now I really see this new field called culinary medicine. It's the intersection of, if you've been to the doctor or if you've read anywhere, it's like, oh, diet and exercise. It's like, well, what does that really mean? What does diet mean? And when we're counseling patients, well, everyone knows they're supposed to eat vegetables and fruits. Of course they do. Everyone knows they probably shouldn't eat, 8 servings of Takis every day. They know. But what does that mean for practical implementation? That's what culinary medicine is. It is healthcare professionals who understand food is medicine. It's a new emerging, I would say, ancient way of practicing medicine that's kind of re-emerging, I should say, that really helps break down time, cost, and skills for patients and their caretakers to actually help put nutrition at the center of health. So that's kind of really what my next stage of life is in this career is to prevent those diseases that I otherwise continue to treat. Um, and do that by educating and empowering families, schools to really prioritize food as health.
I love the idea of just culinary medicine is about cooking so that you don't need medicine, giving yourself real nutrition and real food so that then you don't need medicine to treat diseases that ultra processed food, et cetera, causes. And I think more and more people are craving to take their health back in their own hands and, relearning those kitchen skills so that they can have the culinary know-how to cook for themselves, cook for their family. That's when my nutrition journey started too, is when I had kids. It's such an aha. And I love that you were already medically trained, and then you also were, learning at home what worked and what didn't work. And then you decided to start and then you decided to also start a company because you saw this big opportunity. Can you talk about the journey about your company? Tell us about it. Tell us about the journey a little bit. Like, okay, you're wearing a doctor hat, you're a twin mom, and you should also start a company. Like, well, talk to us about that.
Again, crazy person. So for me, all of this is rooted around mealtime. Like everything that has kind of been core to who I am, what I do is around nutrition. Also, like food is health and food is medicine, but food is love. Like it's just like it is my love language. And so I was just going about my business, being a doctor, continuing to treat patients. And then I get a text message from my group of pediatrician friends. We all did residency together in Chicago. We all had kids. And one of them, who was a neonatologist, texts and said, "Oh my gosh, have you seen the new American Academy of Pediatrics policy statement?" And it was about plastic. And they said, "What are you going to do with all your plastic dishes? Oh my gosh. Like I've been putting mine in the dishwasher. Like all of my kids' dishes are plastic. What are you all going to do?" And so in 2018, we had real scientific recommendations. Like this wasn't just small case study, or this was like a policy recommendation on behalf of the largest medical organization in the country talking about food additives and children's health. And it did a specific call out to plastic. And so years before, I did what every other mom does, right? You go to the big box stores and you see the cute little plastic dishes with the suction and the Mickey Mouse and all that, and you buy it for your kids when you introduce solids. And but not everyone has my mom at home, who walked in one day and said, "What are you doing with this plastic for my grandchildren?" And I was like,
In
"Wow,
my grandchild's body. Yeah.
yes." And she said, "There are chemicals in there. They're definitely getting to the food. Look, you can smell it. Ew." And so she was there to take care of my children while I went to endocrinology clinic. I came home. Everything was gone. Like literally my cabinets were all like, I was like, "Mom, where'd everything go?" She's like, "I threw it away." And I'm like, "Oh,
I
okay."
love her.
"What are we going to eat out of?" And she was like, "I will bring you the same steel that you used to eat off of." So that's where the story started, because American Academy of Pediatrics, 5 years after my own mom made me ditch the plastic and use steel, formally said, "Don't use plastic. There are chemicals in there that actually interfere with your children's hormones, their development. Use glass or stainless steel." So that's when I decided that we as pediatricians were supposed to make a really big recommendation, but then like parents didn't have a solution to follow those recommendations. You could go into the stores, you could go on Amazon, and you couldn't find just steel dishes. And there's like 1 billion people in India eating off of steel for generations. And so it was just kind of a aha moment of, yet again, there's another endocrine disruption, because I was trained in endocrinology. So all of these different pathways kind of just converge and saying, I see kids with issues with hormones. I see the food system. I see the plastic. Let me create a company. And had I known what entrepreneurship was like, I don't know if I would have taken that leap, but here we are.
You're doing it though. Talk to us about the company.
So the
You
company,
did it.
I did it. Yes. And I did it because I didn't do it to start a company.
Yeah.
So I'm a problem solver by nature. So if I see a problem, I'm like, I can't sit still. I'm like, how do I solve it? How do I solve it? How do I solve it? And so that's honestly where this company, Ahimsa, came from. It was this very clear scientific evidence on what was happening with children's health, and a very clear solution that was tried and true around the world, but we didn't have it in this country. So how could I kind of bring it to life? So I launched a company called Ahimsa. The word Ahimsa is a Sanskrit word meaning avoiding harm. So it was like a beautiful word describing, like, the first oath I took as a doctor, the first oath I took as a mom, certainly an oath that I take as a human in terms of my planet. And so it was just like this nice little word. And then I just decided to launch a line of stainless steel dishes for kids, which sounds so silly because it's not, some big new tech or vaccine, or like it's not, right? It's just a simple thing, a plate, a safe, sustainable, smartly portioned visual map for healthy eating plate. But it kind of goes back all the way to everything we just talked about with culinary medicine. Food is the gateway and path to health. And so I really was not launching a company. I was actually trying to create solutions for the everyday parent who, quite honestly, walked to my clinic and didn't know what to serve their kids, didn't know that half the plates should be fruits and vegetables, like, didn't know that the ultra processed food. And so it really became a symbol of like, Ahimsa is really a public health policy. We just disguise it with really cool rainbow steel products and products for schools that really serve as tools for health. And so, and now we've got this platform. And it's like, okay, well, while I have you, let's also change all the food that goes on that plate, shall we?
I love it. I just feel like also like it just makes it fun. The whole brand is like do no harm and have fun with food, and it makes it, something that the kid is proud to bring to the table and then clear the table with, and that they have their blue rainbow or their rainbow, and it's like brings so much joy and vibrancy, and it brings people to the table. So I love the joy and the positivity of the brand, and
It's
then that it does.
our probably one biggest thing that all of our consumers say, like every parent who has a HIMSA, they say, my child won't eat from anything else. Like this is their plate. And it's, what's interesting is that is real behavioral change, whether that happens at home for a child or at school. They're taking this, there's value brought back to their meal. They're like, this is mine, this is valuable, this is like, I feel proud, I feel empowered, like I want to be engaged with this process, right? And the second most common thing is like, now I gotta like actually fill these different compartments with things. Thanks, Dr. Mantravadi. I have to serve more than the nuggets because the kids are like,
Yeah. Yeah, it
visually
encourages more
speaking.
color in the diet too. Yeah,
That's
totally. They're
right.
like, well,
That's
what's
like,
on this pocket?
that's right. And
So
so
I knew the brand, and I was like fangirled you from afar. And then our friend Will friend dated us, and like I instantly fell in love, of course. But I didn't know the full extent of how you were also working in schools. In my day job, I'm the CEO of Eat Real, and we're changing the school food and helping the cafeteria become the best classroom in the country, and making school food the most delicious meal of the day for kids and nourishing. And I was so excited to learn about what you're working on, because plastics are so pervasive in our food system and in our kids' school food system. Actually, on the podcast, I had Dr. Leo Trisande, and he talked about 14,000 chemicals in plastic, and how a lot of plastic is recycled electronics, which then if you think about giving your kids leaching electronics, you can't unhear that. You know what I mean? And so I think,
petroleum-based plastic, like you just let it drink the gasoline. Like you wouldn't do that. Like you wouldn't
yeah,
really do that to your child.
yeah,
No
you're not just gonna
way.
go to the gas pump and like then pour food on top of that for your kid. No, and you can't unsee those images, right? Like people don't know that plastic is made from those things, I think, so still. And so I was so excited to learn about what you're doing. So can you talk a little bit about more the industrial side of things and
Yeah.
how and your work within schools? Because I think people don't always know that what the brand is up to there.
Yes. So when we first started, we really launched as a solution for parents, for families, for kids at home. And that just came from like this natural journey of my girlfriends being like, what do we do? Like we can't put plastic in the dishwasher. And so that came kind of naturally of like, well, we have to help people at home. But then what I quickly realized is at my own kids' school, they were eating off of plastic reusables. And I could see like the etching and the plastic coming off into the food. That was one of my biggest aha moments. But then also I take care of children, from a from across spectrums of socioeconomic status, right? So like, doesn't matter if you go to a private school or if you're going to a Title I school, like I'm taking care of you as your pediatrician, right? And so my job is your health. And so, and it's an honor to be a physician because we get to see this world. It's such a personal level, but it's such a wide, like level of humans coming into our clinic and kind of relying on us for some of the most important decisions of their life, you know? And so what I was also shaped by is a lot of my patients who are suffering from chronic conditions were also very poor. They didn't have access to healthy food and they were enrolled in school lunch. And I realized very quickly, wait a minute. Yes, it's important to fix the home. But the mom who is working 3 jobs is not thinking about her stainless steel rainbow plate. I'm sorry, but she's not. Like, that's not what she's saying. She's thinking about how do I get the next just piece of food on the table for my child. And that really is at school. And so that's where kind of like connecting the dots. It's like, how do I serve all children? Because it's very important to me because that's who I am as a pediatrician. And so, yes, it's important to have a consumer product, but also it's important to change institutional change. And so that's really when we said, okay, if most schools are single-use, heat and serve, plastic, ultra-processed food, and there's 30 million children eating this way, and the poorest children in this country have the worst health outcomes, well, clearly school lunch is a opportunity for change. So we launched about 2 years ago a school line. Again, very simple, reusable stainless steel trays, because everyone knows that colorful plastic disgusting tray that hasn't changed since the 1950s. It's still around. It's still around. And so it was just like, it's time for a change. And I think the other thing I really was shocked by is the number of schools that were using single use. I think that there was starting to be a change towards reusables, and then COVID hit and everything went backward to single use. And so I was just seeing that not only were we exposing droves of children to plastic chemicals, with single use. Then we were having a whole nother kind of segment that were using reusable plastic and putting them in the dishwasher, which is absolutely against like all medical policy, right? And so there's just this, like, the overwhelming majority of American schools were not following the 2018 American Academy of Pediatrics policy statement by Dr. Tresande. And so that was like, whoa, there is such a huge opportunity to really drive institutional change and policy change and tangible results for those kids. So that's why we created a line of stainless steel foodware. Not very sexy, but it works.
I love it. I love it. And I think, and yeah, I think people don't know even the harms of heating up plastic. Can you talk about just like when, whether it's going through the
Yes.
dishwasher or whether it's a container that holding food, like why, how does like, I don't think people know the word that that's an obesogen and what that means. So can you kind of
Yes.
talk through that a little bit?
So at the highest level, what's really important to know is that everything's a chemical. There are natural chemicals and there are synthetic chemicals. We are made of chemicals, right? And so plastic is a synthetic man-made chemical. You should not find it in our body. But now, in this current day, we are finding circulating levels of plastic chemicals in our body, even at the level of in utero, meaning in the fetal circulation. So we are seeing that our constant exposure to plastic is actually going into our body. And what it's doing is it is altering many things, but specifically our endocrine system. So endocrine is another word for hormone. Most people think about hormones with adults, like a lot of people think about fertility and other things in the adult world. But what people don't understand is hormones and the hormone system is incredibly important for children to grow and develop at the proper age and stage, which is why, like, when you have a baby, we do congenital thyroid testing, right? Like, we would just make sure on that blood test, like, their thyroids, because we know if they have low thyroids, we can give them thyroid so their brain can develop properly, right? So these are all very important things for normal growth and development. These chemicals in plastic look like our normal hormones. And so when they're seeping in and kind of like in our circulation, they're wreaking havoc on what otherwise it is a pretty well refined and well oiled machine of the proper ages and stages and timing of hormones to be released, of brains to grow, of muscles to grow, of pancreas to release insulin when it sees sugar. And so now we've got these chemicals in plastic that are just like, and they're like making everything go haywire. So what we see now is, you know, type 2 diabetes in children is at an all-time high. I mean, it's rising since 2020 at like more than, 60%, 70% rise in such a short period of time. These chemicals can increase adipose tissue. You kind of talked about that, like the fat cells. So a lot of what we're ascribing to, oh, well, those kids just don't eat well. That's not fair. That's not fair because we actually have chemicals inside our food system that is changing the way that our cells are actually interacting. And so that's what people don't quite understand is that plastic can act like this hormone that is otherwise normally supposed to allow you to go through puberty at the right time. We're seeing kids as young as 6 undergoing puberty. And so when you see these big, huge changes, right? Children didn't have type 2 diabetes. Now they have type 2 diabetes. Puberty is onsetting at such a low age. This is called like population studies, right? It's not like,
And we're actually aging our kids earlier. We're causing overgrowth, and then also that we're actually moving up diseases that used to be in adulthood into childhood, and moving up
that's right.
puberty that used to happen in adolescence in childhood.
That's exactly right. And that's not genetics. Genetics doesn't change in a generation, but these constant environmental exposures definitely can change in a generation. And so I think that's what people need to know. Plastic is always, you're being exposed to plastic all the time. That's not to make people feel scared. It's just to make people aware, to understand, okay, it's everywhere, but where can I make changes? And like, that's the goal for like everything that I talk about, everything I teach, everything that the company stands for, because you can't change everything, but where can you change it? Okay, well, we eat 3 meals a day and 2
Yeah.
snacks for kids, right? So
Yeah.
there's a perfect opportunity that happens every single day, no matter what, because we're humans, we have to eat. And maybe you can't scratch cook every single meal, but man, could you just at least on occasion not use plastic? And if you're going to use plastic, not to expose it to heat, because what happens is while these chemicals are kind of transferring into the food and drink your children are eating and drinking, heat increases that migration, increases that transfer even faster and to a greater level. And when things are etched and scratched, it can also increase that. So in Dr. Tresande's policy recommendation, it said, number 1, parents, avoid plastic if you can. If you can't, try to most certainly don't expose it to heat and don't use it past when it's etched and scratched, because that's kind of like accelerating the process.
It's been
So
chipped and those particles are floating around, and then you're ingesting them and whatnot. Okay. Nourish with Nora is brought to you by Rora. I trust Rora products every day to provide clean, delicious water for our family. Not only do the Rora countertop system and filtered shower head look beautiful, they are rigorously tested to significantly reduce your exposure to harmful contaminants by the best labs in the world. I love that our drinking water and bathing water are safer. And honestly, it just tastes so much better. My kids are now asking for 2 water bottles full of Rora whenever they head out the house. Check out Rora.com and tap into clean water today. That's RORRA.com. Thank you. And as a mom and pediatrician, obviously, okay, so focus on the food and the containers the food are in, and not, microwaving plastic containers and then putting it on a plate when you can, avoiding that. What about kind of other plastics that if you were like, or that you try to be kind of in priority, like one of the majors that you really encourage your patients and your kids to kind of move away from?
So I think in general for everyone to hear, it's not everything all at once. Like that just feels overwhelming.
Yeah.
And
Do what you can.
yeah, and so like what I don't want to stress to anybody is to then add more fear, but rather feel really educated and empowered to make the decisions that are best for your family at that time, right? And so for example, if it's, hey, the Tupperware that used to be the thing, change that into glass or steel. Okay, great. That's like one change, you know.
Yeah,
Your
or you get a
children,
glass jar, use that glass jar. You don't have to go buy new Tupperware. You've just been like reusing the mason jars or reusing the
that's
jar that we bought the pickles in, or
that's exact spaghetti jar, everything. Just reuse the things that
wow.
you had in better materials like glass or stainless steel. And actually in that policy paper, they did talk about glass and stainless steel being the safest options just because it's been studied the longest
Yeah.
in terms of its human health impact and environmental impact. So those are kind of like, you know, in the kitchen stuff. Other things that people don't think about, something as simple as not saying no to the receipt. So if you're going grocery shopping, just say no to the receipt because that's actually lined in BPA, which is crazy. And that's actually one more little point that I like to make. Just because it says BPA free plastic does not mean it doesn't have all of these synthetic chemicals that interfere with your hormones. That's important because that's a big marketing tool.
Yeah.
But I want
And some
people
of the
to know,
alternatives haven't been studied yet. So then they're
yeah,
swapping out the BPA, and then that new version hasn't been tested as
yes,
much.
but it's what we do know from people like Dr. Trisande and other researchers is the alternatives, BPS, BPA, just choose a letter, BPX, right? They're a group of bisphenols. So it really just is a group of chemicals that act the same. Um, you know, and it just happened to be that BPA was kind of targeted, but they all kind of act the same. So I don't want people to think like, oh, well, BPA free plastic is safe. It's not. It's not, and that's just the scientific truth. But the lining of that thermal receipt paper is lined in BPA. Things like, for example, canned food that actually has BPA lining in it. So these little things that you don't necessarily think about because you're like, oh, it's paper. Oh, it's a can.
Aluminum. It's an aluminum can.
Yeah. So again, do you need to ditch everything that you're doing? You can't live a plastic-free world, but maybe you could just decrease the amount, right?
And you are
Maybe
seeing companies say BPA, non-BPA lining. Like there are swapping some of those linings. So
yeah. So, but that change in industry is driven by consumer change.
yeah,
So what I want people to know is when you say no to something or when you buy less of something and buy more of something, you're already part of the solution. You are shifting. You're shifting. You know, we used to, Dr. Sunday always says this, we didn't have organic food. And then the delta when it was first, you know, introduced was pretty high. And now it's like, oh, well, you can at least find organic blueberries at Costco and the price difference is not as crazy, right?
yeah,
Now,
yeah, yeah.
does it come in a
Consumer
big
demand
plastic?
shifts the market.
Yes. And so, you know, these little things, and even something as simple as, you know, going to like, I'm from Indiana, we don't have like farmers markets all year round that are like in
Winter.
California, but yeah, but listen, when you can support local and not buy the mass packaged plastic bell pepper that why are we wrapping produce in plastic? Like just those little things now
Yeah.
starts to get people to make these tiny changes that actually can make a big impact. So don't feel like you have to do everything all at once. Just start to like make some small changes and don't feel like you have to eliminate, but at least decrease exposure.
What about wearing plastic and polyester and whatnot? Because like kids get sweaty, they're running around. Adults, go to workout class in plastic. That's something I've been examining a lot. Yeah. What about that?
Yep. So again, it sometimes feels like, oh my gosh, I can't eat, I can't get dressed, I can't even breathe. There's like plastic in the air. Do what you can. That's when you can and what's most important to you. So, like, for example, my journey for plastic free really started in the kitchen because that's my passion.
Yeah.
That's like my love language. I have a good girlfriend. She's from the fashion industry. She started in kind of that aspect, right? So her clothing for her kids, especially, it's mostly cotton. It doesn't have a lot of dyes in it, so it's like muted colors. And so one would kind of look at it, it's like, oh, is that a fashion statement? It's like, no, actually, she's being very, very intentional about how she's dressing and exposing her children. And so find what works for you because you're more likely to make those changes,
Yeah, I love
right?
it. And
So
get
it doesn't,
started and micro changes add up. Like
yes,
our bodies regenerate, kids can filter through it. Like it doesn't have to affect their puberty age if you can make some major changes, and look at the different exposure that they're getting.
that's right. Listen, because you can't go out and change you physically can't go out and change exactly your drinking water or the air you breathe immediately, right? But you can make a choice on the clothing, the grocery shopping trip, and what you buy and what you're cooking it. Like you can make, so don't feel like this, like paralyzed by fear or paralyzed by like so much information, but just rather feel like, okay, what's important to me? What can I meaningfully do? And let me do even a little bit of it. And I
Yeah, let's
promise
get
you what
started.
happens is you're like, ooh, I like how that feels. Ooh, I like how that feels. And you
Yeah,
do more
at
and
first,
more.
like what's going in your kid's body, then what's going on your kids. Yeah,
Yeah,
exactly.
that's right.
Well, you did bring up water, and water is one where I'm like, okay, and sometimes my kids drink out of plastic water bottles, and there's like, we're on the go, or we run out of water bottles, or
Yeah.
like it happens, and I'm like, okay, they're going to live. We all have to live in this world while we change it, and so, but Rora, I don't know if you've heard of this company. It's a beautiful home water filtration system. It just won Esquire Design Award, and they just started supporting the podcast, and it's like delicious. They leave in the minerals, but they filter out the bad stuff, like microplastics. And I'm just curious what you think about water filtration. And you were seeing more about the water supply in the United States and how when you can home filter, how it can be really protective. Like you're working on the food and then also thinking about how to not drink out of plastic water bottles and filter your home water when possible. What's your stance on kind of water filtration
Yeah,
and watering
listen,
kids?
I think what we can't change on our own as a single human being is the entire system overnight.
Yeah.
What you can change is again, decreased exposure for your family. So, we filter our water, we try to use reusable steel when possible. You can have air filtration systems like little HEPA filters or open up your windows for some like fresh air. Like all of these things are you're not eliminating to zero, but you are doing the things that collectively, like I said, decrease your child's exposure. And that matters. And like, I want people to feel empowered that like that matters. Like, just because you can't do it 100%. And by the way, people think I'm like the plastic police. And if they're drinking out of a water bottle, they're like hiding in a corner. I'm like, guys, I'm like, it's fine. Like, I also, if I'm on a road trip and, we forgot the bottle or whatever, like, it's okay.
Yeah,
It's
yeah, yeah, yeah.
okay.
Yeah, the stress that we cause ourselves over being so militant about it all. That's why it's like, yeah, it's okay. Yeah, and I don't want to raise stressed kids about it that are running around
Yes,
stressed all the time about what their toxic load is. So it's like,
that's
how do
right.
I give them ease, but give them the knowledge and the confidence and whatnot. It's cool to like also share the information with my kids because then
Yes.
they they police. They definitely love policing. So then they're like,
Oh,
Mom.
they sure do. My kids are they're well versed in all of this stuff, whether it's ultra processed food, whole foods, Nova system, plastics, like, and I
Yeah.
think that's why I went into pediatrics. Like for me, pediatrics is you get to work with the smartest, coolest, kindest, funniest humans in the world, which are kids. And when you are able to just simply show them the way by modeling, they outlearn us, they outthink us, and they outsmart us like all the time, which is why, children's products, opportunities to change school systems is so significant. It's so significant because you're not just like buying a plate. You're not just, creating one scratch cooked meal at a school. You're like literally changing a generation of children. And that to me is so powerful because that's how we have change. It's actually not through the adults. But the issue like is that children don't have consumer buying power. They don't have voting power. And so that's why people like you and me and moms across the country and doctors and environmentalists, like we have to stand up to say, like these kids don't have a voice. So like let's make their school lunch better. Let's make their products better. Let's make their air better. And so that's why I went into pediatrics because you get to actually work upstream. You have to work upstream and change people's lives in a way that's very lasting and impactful.
I love it. And I love that you're making change in your own family and then encouraging other people to just take simple steps, not overwhelming steps, simple steps, but then also think about systemic change too.
Mhm.
You have some of the most go get 'em, earlier you talked about how do I solve this? How do I solve this? How do I solve this energy? Can you talk a little bit about like some of your mindset and like the mantras you say to yourself, some of your like the some of your secrets of like how what is your approach? Because you do so much and you take so much action and you are such a vibrant leader, but then you're also winging for other people. So what are some of your kind of leadership tips and approaches that you apply to yourself that other people can learn from?
So I think, so my husband describes me in the following manner, which sometimes I'm like, huh, that makes me sound really interesting. He says, he's like, Moss is the kind of person who, if she didn't know how to swim, she just literally dive off of the diving board into the deep end, almost drowned, come up, splash around, look really, really just, like she's almost dying. And then suddenly she's like lapping people, right? And so
Yep,
that's
I see
how
that already. We've only known each other a short time, and I totally see that already.
I was like, I don't
You
know
would
how to
definitely be lapping me in the deep end for
swim.
sure.
But I think the point is, in terms of being a leader, I think, listen, you have to, like, if you really want to lead, you can't be afraid. Like, you can't be afraid to not do what everybody else is doing. I have a lot of physicians who are all my friends and whatnot, and like, could I just keep doing the same thing over and over, in terms of treating children? Now, I'm not saying I'm better or different. It is a different skill set in terms of a leader, and certainly to be a leader of a movement like you are, or an entrepreneur like many, many small businesses and entrepreneurs are. It also takes courage. So it's not just the like, I'm not going to be afraid to be different. It's also, I'm not going to be afraid of the ridiculous amount of challenges and work that's ahead of me. So I think, and again, it doesn't mean be completely fearless and careless, right? It just means that being bold and brave to fight and stand up for the things that you feel really strongly about. That to me is like what has gotten me through, because I think when I look back at my life, my skill set is actually that I see a problem and I'm like, gotta fix it, gotta fix it, gotta fix it. But it's never gotta fix it alone. Never, ever, ever. It is, I have to fix it by getting the right people around me and by communicating the issue and then inspiring all of these people to work together to create the solution. And I think that's what has gotten me here. I am not smarter than people. I'm not a harder worker. I just see the power of people working together towards a common goal. And so I think that's in terms of leadership, understanding your role in being able to not just motivate people, but to educate them. Because I think as leaders, if you just tell people what to do, they're not bought in. If you can help people understand the why, whether that's a parent or a school or an employee or partners, if you can explain the why, it works. And we see this in schools. A number of people who initially say, oh, our food service staff, like they're never going to go for this. They're not going to wash dishes. Like it's more work for them. It's more cost. The minute I really explain the health, everything I just explained to you, if I'm able to clearly communicate that, every food service staff is like, I'm on board. Like they don't want to hurt children.
Yeah.
Like they don't
Yeah,
want
you
to.
can slow down enough to explain the why, like, and if you're about to jump off the diving board of life and get in the deep end, and you're like, yeah, you're like, but I need a coach over here, and I need someone over here, and I need someone with a buoy, and you're like, here's why we're gonna do this deep end thing,
Yes.
and then you're more likely to be able to get back up.
Yes. So I think that's the key, like to leadership. It's just like being really genuinely passionate about something and then building the right team around you and being very aligned in why you're doing it. And then it doesn't feel like work. It
Yeah.
feels like you're really coming together towards this common goal that is the greater good. And one of my most favorite books is The Alchemist.
Yeah.
And really the entire story is, if you're intending to do good for the universe will conspire to help you. And I truly cannot explain the success of this company in which I have zero background in terms of business. Like there is no reason I should know any, like I don't know anything about business. I don't know anyone in business. When I started this, I Googled my way through figuring out steel manufacturing and like how to start a business and even how to create an LLC, all that stuff. But I think I was really convicted in this is for kids. This is a problem. I got to solve it. And I'm going to go help. I got to go find the people to help me solve it.
I love it. I love it. So something that you say to yourself is like, I gotta solve it. What I have to solve it. I have to solve it. And like, who can help me solve it? Who can help me solve it? I love it. What are some other like things you whisper to yourself before you jumping off that diving board, or that you say in the morning in the mirror?
So I think one of the things, being a physician entrepreneur,
Mhm.
is that I have this perspective on life that is different than entrepreneurs who don't necessarily see death and dying all the time. And I always say to myself, like, the worst thing that, because I practiced as a pediatric hospitalist for a while, which just means I took care of children who were sick enough to be in the hospital. And there are many scary moments that happen. Um, and so when I think to myself, okay, what's the worst that can happen at my regular job is somebody dies.
Mhm.
And that is literally the worst thing that can happen. Like that is
Yeah.
like in life, that's the worst thing.
Yeah.
And at my work, like here, it's like, okay, maybe a consumer is not happy. Maybe, the finances doesn't make sense. Maybe someone's unhappy here. And like that framework of
Yeah.
don't sweat the small stuff, it's all small stuff.
Yeah.
I
It's
think
not, this is not
really,
life or death. This is actually not life or death. Yeah, right now. Yeah.
yeah. And I mean, like maybe it's a morbid way to look at it, but it really, I think, helps understand like what it's like. We just talked about the greater why, but then when you're faced with challenges, you're like, okay, why am I doing this? Oh yeah, it's the big thing. Okay, what's the worst that can happen? It's okay. Like it's okay. Everything, it doesn't mean you just say everything's okay and like
Yeah.
your balance sheet is off the like your business is
Yeah.
sinking or like, people are unhappy. That's not what I'm advocating for. It just means like that those are the times that in entrepreneurship, especially in leadership, the lows are lows, the highs are highs, and in those lows you really need to be grounded in like I can do this. Everything is going to be okay. It's not the worst thing in the world. And let's problem solve with people
Mhm.
on how to solve for
Yeah.
it.
Yeah. Kind of an exhale. I'm alive. I'm gonna figure this out. Yeah, exactly. Yeah, I love it. I love it. Um, you also always bring a smile. Always. Like you just don't like you're like, and I think it is this like we're not dead, we're alive right now. And you just bring this aliveness to everything you do, whether it's a stage or a presentation or a meeting. And I just love it. I just love it. I just feel like you're
I
in such
also have a
like
nervous smile. I don't know. It's like, like if I don't know something.
we're alive, we can smile, we can find something to smile about every day. For sure. For sure. Okay, so in closing, you are joining Eat Real's medical advisory board. I'm so excited. Thank you. We're making a big announcement soon, but I am so thankful that you're supporting the nonprofit where I'm the CEO and helping us build the movement. Could you talk a little bit about why you're so dedicated to solving the health crisis with big, bold solutions and kind of what your approach is and why eat real, why food, etc.
So, we have an epidemic rise of chronic conditions in children, and most of them are preventable. And so I am a pediatrician. Part of my job as a doctor is to treat people when they're ill. But the other half of my job, especially in pediatrics, which is the single most important part of my job, is to keep kids healthy in the first place. Like that's why you go to your well child checks. That's why you go to your pediatrician and make sure everything's going right. And so to really hone in on improving health outcomes for children, we have to focus upstream. Like we have to focus upstream. And when we look at the, 1 in 5 children are now obese in this country, type 2 diabetes in children since 2022 are rising about like 70%. When you look at this and then look at the rest of the world and how different their school lunch programs are. So in Japan, They prioritize scratch cooking, whole foods, nutrition education, in which are getting the kids involved at an early age, understanding where their food is coming from, how it is fuel for their body, and you're educating them about the food. Their health outcomes are significantly different. It's like less than 4% of their population is obese, right? And so why that matters is what we teach these children at the youngest age in the most important setting, which is school, sticks. And right now, we're teaching them to heat and serve, single use, ultra processed food. It's kind of not rocket science to see that the outcomes for those children then growing up as adults is a reflection of what the lasting impact of single use, heat and serve, ultra processed plastic nutrition looks like. And so I firmly believe that the answer to the health care reform in this country needs to stop thinking about treatment and really reform school lunch. So I say school lunch reform is healthcare reform. And the faster we can get our youngest members of society healthier, they're going to be healthier. They're going to live longer. They're going to be more productive. They're going to honestly solve a lot of our climate problems better than any one of us. And so if we, and our healthcare costs will go down, because right now we're funding school nutrition programs through our taxpayer dollars. And then we're also funding, the same patients who are getting those chronic conditions, and we're paying for their metformin that they quite honestly never needed. And that metformin, I promise you, is much more expensive than the apple that we could serve at school. So that's like in my closing. School lunch reform is healthcare reform. And everybody at the table, from politicians to pediatricians to parents to businesses, should think of that as the top priority for the future of this country.
I love it. I believe that school lunch is the big bet and that it can be delicious, it can be sustainable, it can be local, it can be plastic free, it can be so nourishing. And I am so thankful to be working on this with you. I think I'm thankful to learn from you about all things food systems and kids' food, but also plastics and entrepreneurism. I love that you are such an Eat Real champion. You're an Eat Real champion. You know, as an advisor to us, but then also you're helping bring Eat Real to Indiana and
That's
helping
right.
then
Hear that, Indiana? Every Indiana
we
person
can
out
help
there.
Indiana. Yeah, if anyone wants to get involved, they can go to eatreal.org/parents if they want to get their school district involved in their state. We're launching in 20 states. But yeah, you're going to be coming to DC. Like, you are just a mom on a mission, an entrepreneur on a mission, a pediatrician on a mission, and I am so thankful for you. I'm also so thankful for our new friendship, and you are just so much more joy in my life, and you are helping make it easier for parents to create healthy kids. So just thank you, doctor.
Oh, well, thank you. And I think, everything that everyone does matters. And so whether it's me doing my stuff, you doing your stuff, any parent listening to this, making that small change, it all matters. So we got to do it. And I end all of our meetings saying, for the kids, because that's what we do it for the kids.
For the kids. Okay, Dr. Manasa Mantravadi, can you please tell us where people can find you on social media?
Yes, you can go to @Ahimsa Home USA, and you can follow along with our company, not just for products, but for real education. We have an entire content platform called the Pediatrician Kitchen. And so you can learn tips and tricks on how to really prioritize food as health for your own family, to combat the cost and the time and the skills of cooking. And if you're a school administrator, or if you're a parent who wants to get involved with the schools, you can go to ahimsaschools.com. And there we've got our Conscious Cafeteria program, which is a combination of educational curriculum. We've got a report on really understanding the financial and environmental impact of going from single-use plastic to reusable. So we're not just products, we're really a public health mission designed to be solutions, but also educate and empower people about their own health.
I love it. And then also you're on LinkedIn.
Yes,
so people can find, I love following you along on LinkedIn. So people can find you there.
You can find me there.
I love it. Okay, cool. Well, thank you so much. I know it's that you have 3 kids right now that were just popping in. So yeah, just thank you so much for sharing with us and being here at Nourish with Nora.
Thank you. Cheers, everybody.
For the kids.
Yes.
This episode was brought to you by Rora. Rora, thank you so much for supporting the Nourish with Nora podcast and helping bring cleaner, safer, and absolutely delicious water to families around the country. Visit rora.com/Nora, that's RORRA.com/NORA to get 10% off your countertop system or filtered shower head today. We hope you'll subscribe to Nourish with Nora everywhere.